You'd think that by the end of an 8-hour meeting, you might have some idea of what you and your colleagues are actually voting on. Apparently, the CDC's new Vaccine Advisory Committee, handpicked by Robert F. Kennedy Jr., never got that memo.
I'm still not quite clear. So if we, the first vote has passed already, and if we vote no on this item, then what happens?
And Bodie and I share the same confusion here. Okay.
I'm going to abstain because I'm not quite sure what I'm voting for here.
We are rookies. And with one exception, this was either our first ACIP meeting or our second. And there are many technical issues that we might not grasp as of yet.
Almost like it helps to have officials with experience running public health organizations. After sorting through the confusion, the panel redid several votes on Friday. And here's where they landed. No longer advising that MMRV vaccine for measles, mumps, rubella, and chickenpox be given to children below age 4, and that children should get the MMR and chickenpox vaccines separately. The vote on whether babies should get the hepatitis B vaccine at birth has been postponed indefinitely, and perhaps most importantly, requiring that patients consult a healthcare provider before receiving a COVID vaccine, meaning in some states, no more walk-in vaccinations at the pharmacy, although they stopped short of requiring a prescription. Confused? So is the committee. And now so are millions of families now left wondering which vaccines their children should get and who will pay for them. But the process didn't go without major criticism from public health professionals, as you'll hear in this audio of their Zoom call.
I would argue that this recommendation is going to create more confusion among the public. It does not involve the aspect of actual practicing clinicians and how we deal with vaccine hesitancy and how we talk to our patients.
I've been a practicing infectious disease physician for over 40 years, and there is nothing worse, nothing more haunting than watching an unvaccinated child die of vaccine-preventable disease. I still hear this young teen asking me if he was going to die. I'm here today to urge you to make decisions that will decrease, not increase, such deaths and illnesses in our children.
I cannot sit silently as Secretary Kennedy undermines science, public health, and vaccine access in this country. I urge the public, Congress, and this administration to take proper action and restore the competent science-based leadership at HHS and CDC. For the health and safety of American families, Secretary Kennedy must go.
Those messages very stark and clear. Joining us now is MSNBC medical contributor Dr. Kavita Patel, former White House policy director in the Obama administration. Dr. Patel, I have so many questions for you, but first, you're so good at giving our audience context. How unusual is it to see a scene play out like this with the nation's top advisory panel openly admitting confusion and redoing votes like this?
Yeah, Jackie, good morning. Good to be with you all. It's very rare that I have a text chain with many other kind of seasoned public health people who worked with me in Congress and the White House, staffed ACIP meetings where I said, what the had just happened? I have no idea. And as you heard from some of the voting members, they felt the same way. You can imagine that if you're actually just trying to unfold, if you're working in a high-risk nursery while this is unfolding, you can imagine that you have no idea what you're supposed to do when a baby is born. Which vaccine? What do I do? And that's exactly how these last few days have felt.
Dr. Patel, one of the promises from RFK Jr. and the MAHA movement there's a lot of promises, some of them half-baked, but two of them seem to go against what this panel just did, which is kids should have less shots and parents should have more choice. With them separating the MMRV vaccine, with the MMR being one and the chickenpox vaccine being another, they are going against what they promised the American people, which is more choice for parents, right? Parents now currently, before this vote, could choose whether or not their kid got an MMRV vaccine as one or split it. And two, they say the kids are getting too many shots. Now you're adding a shot and the parents have less choice. Help me kind of make sense of that.
Yeah, it does seem like not just in vaccines, but there are kind of signals in other areas in public health that they're taking away choice in selective kind of categories where there has been a significant ideological shift. There's not a science shift. I want to make it clear. Viruses don't know politics. They don't know state borders, country borders. And what they've done is essentially said, well, this is a group that has been over vaccinated and largely after COVID, I think, kind of dealing with the fact that we had those mandatory school closures, small businesses shut down. And I think I'm at least here to say, not a single one of us that work on the clinical front lines ever just say, this is what you're doing. You don't have a choice. Even at birth, we never do that. So I think it's really also kind of, I've actually said, this is probably the worst clinical burnout. And I burned out pretty hard taking care of patients during COVID. But to watch this science kind of being taken, and as you describe, being selectively used kind of against even our recommendations as doctors, it's truly unprecedented.
Yeah. Dr. Patel, there's so many things about this particular story that just make my head hurt. I can't believe we're having to talk about any of this because it's all generated because of people who have no idea what they're doing and no expertise.
They admitted it. They don't know. They said, we don't know what we're doing. We're early.
Like nothing. And I have so many tweets and stories and sound bites that I want to ask you about. But let's just go to this post that was on X from Wednesday. This is a new ACIP panel member, Dr. Robert W. Malone, was asked if ousted CDC Director Susan Monterez was trained by the CIA in how to lie and manipulate others. And you can see it there. The CIA trains people how to lie and manipulate others. That is a fact. Has she been trained to lie by our intelligence community? Now, we're talking about her because did she quit or was she fired? She did not want to do what Secretary Robert F. Kennedy Jr. wanted her to do. Just jump ball. Just take that.
Yeah, I'm happy to take it. Look, I think that, by the way, not just that comment from Dr. Malone, but other comments made by other committee members, as well as, frankly, Secretary Kennedy, resulted in CDC staff actually not being in the room with the committee due to safety concerns. So just putting it back into things into context, I've never attended a meeting where the staff that actually staffed the meeting could not be in the room. So that tells you everything you need to know from not just that tweet, but I think where we are in public health. And I keep saying unprecedented. I've never seen this in decades of working in public health. I think unfortunately, the bigger consequence is that there are going to be unnecessary deaths, unnecessary hospitalizations. I have already heard about clinics very close to me in a very blue state that have said, we're not going to carry the COVID vaccine. It's not worth the trouble. So I think that we're going to see the repercussions for years to come.
Dr. Patel, really quickly, just in a few words, I mean, the economic strain on our healthcare system between this and the unprecedented cuts that we've seen enabled by the passage of the big, beautiful bill. What does that look like?
I think this is going to result. So right now we've been talking about vaccines and that you need to CDC recommendation, which hasn't been signed off by the interim CDC director, but likely will, should decide with their clinician whether they get a COVID vaccine. We've already been talking about points of access. Most people don't even have a regular clinician, 4 out of 10 in most areas of the country. Then on top of that, add to it that we're going to be taking away millions of people from the rosters of Medicaid. This is only going to make crises worse. Our ERs are going to be fuller. Our urgent care centers are going to be overwhelmed. We're going to see an entirely new version of kind of frontline clinician burnout. And I think, unfortunately, patients will suffer and children will suffer.
And will the insurance companies pay for these vaccines if the CDC doesn't tell people they should have them? That is that's at the top of the list for me.
They put a statement out that they will, but you know what? You're right to make that point. It could change, and we have to watch it. It's a moving target, as you've seen with federal broadcasting and FCC guidance. It's not clear what happens if people go against the federal government, should these recommendations become black and white, which I expect they will.
Wow, thank you for this terrifying conversation. Dr. Kavita Patel, as always, thank you very much for coming to The Weekend.